Hi, my name is Nadia Diamond-Smith, and I am going to be presenting some work with collaborators from URC, and I'm at UCSF, and this is part of the HERD project. And I'm going to be presenting on our findings of a scoping review of respectful maternity care related interventions. So just a background, as we all know, the prevalence and incidence of RMC and DNA has been documented, and there have been a range of interventions. However, we don't know a lot yet about what types of interventions have been implemented and which type of interventions should be implemented. And we also know that different terms and framings are often used to describe and contextualize RMC. So the aims of our study were to identify and disseminate a summary of some of the promising approaches for RMC interventions in Africa specifically, and to explore a little bit more about terms and frames used for RMC and RMC-like approaches. So to do this, we used two different methods. The first was a rapid scoping of published literature and gray literature, and this informed both of these two analyses. And then also, we did a crowdsourcing exercise where we sent out a survey through our network, and hopefully some of you received that survey and responded to it. And from that, gathered some more information about interventions that were going on right now. Just to provide a little bit more detail about our three methods. So first, we conducted a literature search, and this was of gray and published literature. And from this, 21 interventions were identified. And these were ones that did something to promote RMC and address DNA, had to be an intervention. We were focused only in Africa and between 2009 and 2020. And then the second approach was the crowdsourcing survey. And from that, we were able to get a total of 12 complete or mostly complete entries, again, from Africa. And then we also integrated a search of Ministry of Health websites. And from that, we're able to find 16 strategic plans and guidelines. So some of these, there were some overlaps. So in total, we found 43 unique different interventions across 16 countries, and our timeline was focused between 2009 and 2020. So as you can see from this map, most of these were interventions or approaches were happening in East Africa. Tanzania had the largest number of them, and we can see that there's been a large increase over time in the number of interventions that we identified related to RMC. So we looked through all of these 43 interventions and categorized the type of intervention into 9 different approaches. So the first is training healthcare personnel. So this includes training them on the importance of RMC, effective communication, informed consent. The second group was around facility level improvement, so check-in processes or clean bathrooms or private examination rooms. The third was around supporting the wellness of providers, for example, resting areas with tea. The fourth around implementing some type of quality improvement program, such as routine M&E. The fifth was on changing government or global policies and guidelines, such as incorporating MNC into national training guidelines. And then, so those were all sort of supply side related interventions. And then we had a group of demand side approaches. So the first of these was some type of approach advocating for RMC. The next one was around educating birthing persons. So for example, educating women on their rights. And then the third was around some type of engaging community members, either health workers or companions or family members. And then the final group was something that sort of combined the supply and demand side, and these were some type of social accountability mechanism. So as you can see, the majority of interventions that we identified incorporated some type of training healthcare personnel. So the blue line is where that was the only approach in that intervention. And then the purple is where that was involved with some other type of, there was multiple different approaches within one intervention. So most of the approaches that we identified did have multiple different ways that they were trying to intervene to improve RMC. Facility level improvements were also quite common, as were some educating birthing people or engaging community members. This just shows the single versus multiple interventions and at different levels. So we can see that a number of the interventions we identified were just working in one community or one facility. There were quite a few that were also working in multiple communities or facilities, and then fewer that were, working in multiple countries or at the whole country level. We reached broadly to not just look at the time of delivery. However, the majority of interventions that we identified were focused right at the time of childbirth. You can see this line here and in the middle. However, a number of them also had some either targeted women in the pregnancy period or postpartum, or even reached into the newborn and child period. Very few encompassed even a broader lens of family planning or some other type of health service. So since the trainings were most of our interventions included some type of training component, we decided to look at those a little bit more closely. You can see that most of them were situated in East Africa. Most of the training did involve some type of other approach, so 75% of them, 15 out of the 20, incorporated training plus something else. Most of them were specifically focused on, had RMC or DNA specified as a primary objective. Most of them focused on clinicians and other non-clinical workers. Unfortunately, there was not a lot of detail about what actually happened in the training. So this is, future research should give us more information about what they're actually doing. But of those that we did have information on, most of them seemed to involve some type of interactive design or role play. And a large majority of them either occurred over multiple days or had included consecutive series of trainings with ongoing mentorship or support. So moving on, we thought it would be interesting to look at how people are talking about RMC and how that's changed over time. So the different bars here show titles and abstracts of publication that either use the term RMC or disrespect and abuse or mistreatment or experience of care. So we can see over time, of course, there's been an increase in publications using all of these terms, but it seems like more and more people are talking about respectful maternity care. That's that yellow bar, which we can see is increasing pretty steadily over time. And we mapped that alongside some of the main policy documents or that have been, statements, global statements that have been published over time, just to see if there's any relationship between how, people are talking about this in the larger global domain versus in their publications. And then looking more closely at the framing people are using in their as they're talking about their interventions and the policy documents. So the majority of interventions that we identified talked about quality of care or cited the quality of care framework as sort of the basis for their intervention. A number of the interventions, specifically less so for the policy documents, talked about a rights-based approach or cited the universal rights of childbearing women. Experience of care and social accountability were also mentioned a fair bit. And a large number of the interventions and policy documents that we looked at talked about more than one framing. So in summary, we found that of the work that's happened in Africa on interventions for RMC, most were in East Africa, in Tanzania especially. Most focused on training healthcare personnel and facility level improvements. Most interventions were multi-component. We did not look at the effectiveness of these interventions in this study. In terms of terminology, over the past decade, there's been a large number of an increase in the number of publications in this area, and RMC seems to be the dominant term used. And in terms of framing, WHO Quality of Care Framework and the Respectful Maternity Charter Universal Rights of Childbearing Women seem to be the most commonly used framings. Thank you so much for your time and looking forward to more discussion later in this webinar.